Lord Clarke has been giving evidence to the inquiry into the contaminated blood scandal. Around 3,000 people died after being given blood products containing HIV and hepatitis C in the 1970s and 1980s. Lord Clarke is the first former health minister from the time to testify. Our health correspondent Reid is following the inquiry.
This inquiry in the building behind me has been examining events that happened 40 or 50 years ago but are still having an effect today. One group particularly affected are around 4,500 people with the blood disorder Hemophilia. Some were young children at the time and they were infected with viral hepatitis and HIV in many cases after being given these contaminated blood products. Now, Ken Clarke, now Lord Clarke, was the chief NHS person in charge of that health policy around that time at the beginning of the 1980s when the first reports of a crisis around AIDS emerged. Giving evidence this morning, he said when he joined that department back in 1982, it was not clear and he never expected a problem like this to arise.
The whole setup, the structure, was a completely shambolic bureaucracy, which is why blood products, which was a comparatively calm area, until it had this horrendous problem that took us all by surprise when a new disease and new infection started emerging, was a quiet little part of all this. It was very big because of the tragedy. Now, big this inquiry.
So Lord Clarke is going to be giving further evidence here, detailed evidence, for the next 3 days at this inquiry. It's important, very much so, for the families, the relatives of people who've lost their lives and the survivors, not just because of the detail of which he's providing, but also because of the principle here. This is the first time such a senior minister has been giving evidence under oath at an inquiry like this.
Reid reporting there.